السلام عليكم ورحمة الله وبركاته. هنتكلم النهاردة إن شاء الله عن الكرونيك فاتيج سيندروم. Definition: it's a disorder characterized by extreme fatigue or tiredness that does not go away with rest and can't be explained by any underlying medical condition. ودي نقطة مهمة جدا، إن ما يبقاش فيه عند العيان أي medical disorder تفسر التايردنس اللي بيحس بيه. Risk factors for developing chronic fatigue syndrome: الage usually between 40 and 50. Women are 2 to 4 times. Genetic predisposition is present. History of allergy, stress, either physical or psychological stress, و environmental factors. Symptoms: symptoms of chronic fatigue syndrome vary from individual to the other and depends on severity of the condition. The most common symptom is fatigue that interfere with the daily activities. This situation must last for at least 6 months, must not be curable with bed rest. Chronic fatigue syndrome also introduce many problems, such as feeling unrefreshed after a night's sleep, chronic insomnia, loss of memory, reduced concentration, orthostatic intolerance. The symptoms may disappear completely, which refer to a remission period, and may return later, which refer to relapse period, which add difficulty in management of the symptoms. The physical symptoms for chronic fatigue syndrome includes also muscle pain, headaches, joint pain without redness or swelling, sore throat, lymphadenopathy in the neck and the axilla. Chronic fatigue syndrome may affect some people in cycles, as I mentioned previously. The diagnosis: chronic fatigue syndrome is a very challenging condition to diagnose. There are no medical tests to screen for chronic fatigue syndrome. أهم حاجة نرول out other potential causes وريفيو الميديكال history of the patient. differential diagnosis، وده مهم في الدياجنوزس بتاع الكرونيك فاتيج syndrome. Some condition with symptoms that resemble this of chronic fatigue syndrome: المونونيوكليوزس، multiple sclerosis, systemic lupus, hypothyroidism, fibromyalgia, major depressive disorder, severe obesity, sleep disorders. واحيانا السايد افكتس اوف certain drug بتدينا برضه نفس المانيفستيشن اوف كرونيك فاتيج سندروم، زي الانتي هيستامينيك والالكحول. treatment: there is currently no specific cure for chronic fatigue syndrome. Every patient has different symptoms and therefore may require different type of treatment to manage his disorder. Multidisciplinary approach is a must. الحقيقة لازم نحدد احنا بنتعامل مع chronic fatigue syndrome ولا post exertional malaise، لأن البوست exertional malaise بيعتبر ببساطة central feature of chronic fatigue syndrome. اللي هو السيمتومز بتبقى مور سيفير ومش محتاجين severe activity. لا، ده even minor physical, mental or emotional exertion results in chronic fatigue symptoms and become more worse. Worsening symptoms usually occur 12 to 48 hours after the activity and last for days or weeks. Activity management, making some lifestyle changes, may help reduce symptoms. A diary of the activity may help determining personal limits, limiting or eliminating caffeine, nicotine, and alcohol. Create a sleep routine. Go to bed at the same time every night and aim to wake up around the same time every day. It's important for management of chronic fatigue syndrome. Medication. Typically, no medication can treat all symptoms. Also, symptoms may change over time. Medication may have to as well. Chronic fatigue syndrome may trigger or be a symptom of depression, so antidepressant therapy may be needed. Analgesics may help with aches and joint pain. Alternative medicine, for example acupuncture, yoga, massage, may help relieve the pain associated with chronic syndrome. What's the prognosis? Despite increased research efforts, chronic fatigue syndrome remains a complex condition with no exact known cause and cure. The recovery rate is about 5%. Lifestyle changes is a must. Chronic fatigue syndrome progressed differently in everyone. Personal adjusted management is a must. Thank you.